Possible action on the July 6th meeting minutes as presented. Any changes requested?
I have a couple suggestions. Under the North Hudson presentation,
Yes.
it says that there was a proposed 50/50 funding. There was also a proposed parity per run funding. Weren't there two proposals, Stan?
I guess, I mean,
Yeah, I think when they made the presentation, there was what exists now, if we went to 50/50, and then what the funding would look like if we went, and each municipality paid the same for an ambulance run. You know, because right now, Troy is paying like $1,000 in support per run, and the city is paying $280 something.
well,
And
those
then-
were numbers that were there
Just fell out.
if we just,
Right, and then we looked at 50/50, and it was still like 800 for Troy and 400 for the city. And then there was the other one, what each municipality would pay if we looked at each municipality paying like the same amount per, per subsidized run.
The 50/50, I think, is the plan proposal, Ray. I agree with Stan, it's just, those are the numbers that are in there. It doesn't change anything, other than that brings up a valid point of what it is all. Just so the city understands that, I'm sorry, that's what the other municipalities are trying to point out, is you're not paying your fair share.
Right.
For a run, you know.
All I'm bringing up is there were three analyses there.
Yeah.
How it was now, the 50/50, and then what each municipality would pay if we got to parity in terms of
Well, we're never gonna get to parity.
Well, I don't know.
Think you'd agree to that?
I mean,
Would you agree to parity?
well, I mean, that's not what we're discussing now, whether we'll ever get there, but there were three analyses put out. That's all I'm saying.
Do you want that in the minutes then?
Well, I think it should say that, that as it is now, a proposed 50/50 funding and an analysis that showed cost if runs were subsidized at a parity level.
Okay, can you make that change? Yep. Anything
And-
else?
And then in discussion and possible action items on the funding model, here it says, Tim questioned Brandon on what staffing model he needed and indicated to continuing changing the roles and pay schedule for EMTs and adding a full-time paramedic. This is the area where I really spoke strongly that I thought that other than hiring the paramedic, at this point, we should be doing nothing until we understand where the ad hoc committee is going. So did you say we should move forward with? Here it says, Tim says we should change the roles and pay schedule for EMTs and add full-time paramedic. I know I came out strongly and said, hey.
I know, but I think that's what I said.
Okay, well, then I think it should reflect other opinions though, because I came out pretty strongly and said, hey, I'm absolutely in support of filling the full-time paramedic role, but other than that, let's wait until we see what comes out of this ad hoc committee. I think I spoke pretty strongly to that last meeting.
You want to add that?
It should be added, he did.
Anything else? Okay. All in favor of the changes indicate by saying aye.
Aye.
Aye. Opposed, like sign. All in favor of the amendment of the minutes as changed indicate by saying aye. 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 Opposed, like sign. Motion carries. Thank you. Financial report, please.
Good morning.
Morning.
In front of you have the June 2017 financial report, or the first half of 2017. If you go to the statement of revenues and expenditures, you can see that operating revenues are 53.72% of budget for the year, so we're over our budget projections for the first half of the year. Operating expenditures are at 46.84%, so we're lower than what we would anticipate for the first half of the year, although it's always important to note out that a lot of that is to do with salary savings for
Sorry, what,
vacancies.
Brenda?
It's because of salary savings
Oh, okay, sorry.
and vacancies on positions or shifts that we're having trouble covering.
Okay.
Yep. So while it looks good, we have to remember that it's because of those salary savings.
It's the same issue we had last year.
And, yep, and every month in
Nothing's changed.
2017. Yep, absolutely. So then if we go to the next page on the cash flow, for year-to-date 2017, we've increased cash by $39,000. However, though, for the month of June, we had decreased by $28,000. The reason that year-to-date 2017 is positive, no different than 2016, is because of those per capita payments, and that's shown under cash flow from financing activities. But if you go up, cash flow from operations, you can see that the cash was down $118,000 in 17 compared to $111,000 in 2016, which is within budget projections. So the department is following the budget, so this is what we'd expect. On the next page, accounts
Can I
receivable.
just,
Yep.
can I just ask a question?
Absolutely.
What is our goal for having cash on hand? Is there one that we shoot for?
There hasn't been a current recommended practice of cash on hand. I think it was last looked at 5 to 10 years ago.
Oh, it was earlier than that.
Earlier than-
$500,000 is what we think we should be at.
What is it?
$500,000.
500,000? That's our
To
goal?
be able to handle payroll. We've talked about it.
Okay.
Okay. So we're at 600 and our goal is
500.
okay.
Because otherwise you start having trouble meeting payroll.
Right. I just wondered, how we're doing relative to our goal. Okay.
Thank you.
Any other questions on that page?
Yep.
Tom?
Brenda, on the statement of revenues and expenditures, the budgeted operating loss is $378,000. Can you, we've got 5 months left. Can you give us an idea based on what the cash flow, well, not the cash flow, but what the income is versus the amount we're saving on staffing as to what that number might look like at the end of the year?
I don't have that ready I did look at it. And I think we're going to be, I would have to say our net revenue expenditure, our bottom line, I'm anticipating to be 0, which is $137,000 better than we budgeted, but it's because of salary savings, a little bit because of increased runs.
Brandon, are we losing revenue because we're not filling staff?
Yeah, we are. There's transfers that we give up because of staffing.
Do we have any idea of how much revenue we're losing because of that?
I can't give you a solid number on that right now.
Is it possible to get that?
We can attempt to. They used to track it, but it hasn't been tracked. And we don't get the phone calls all the time. If they know that we're unavailable, they'll just call the next.
All right.
Would the commission like us to report that in the financial report every month? The number of runs that we weren't able to cover the month before because of staffing?
Yeah, I think that's an important piece of information.
I'm a little puzzled. Why? For what purpose do we need it?
Because we have an issue with staffing,
Yeah,
and we aren't solving it.
okay.
And some of it is beyond Brandon's control. But we need to get a handle on it because we're losing revenue because of our staffing issues.
Okay.
On-
Any other questions?
Well,
on-
just On the flip side of that, is that balanced at all by mutual aid runs that we get because others are understaffed?
Not really.
Not
A lot of
really,
those
okay.
mutual aid ones are standbys, so
Okay,
it's not,
so they usually doesn't end up in a run just to stand by?
the majority of them lately have not.
Uh-huh,
We've moved
okay.
over and just covered the area.
But we could include that.
I'm just trying to understand, you know, as we're just talking about losing runs, are we gaining runs through this mutual aid program, so. Yeah.
I got a question.
Yes.
In the discussion with Lakeview, they virtually always transport. That's the goal. They arrive there, they convince the patient they should transfer. I'd like to know how many times we don't transport.
Yeah, we can pull those numbers. We
Do
have,
you know what I mean? Because we are a municipal service, and a lot of times we don't. And that, we talk about total runs, but we don't talk about total transports, which has an effect on us, you know?
I thought I saw some information where you didn't. There's something.
We talk a little bit about it, but we don't. I'd like to see it in the report, too.
There's a report that Joanne does every month, and we can start expanding on that,
Okay.
where it shows those total canceled calls.
I don't want just canceled calls. I want to know when we didn't transport.
I have the list.
'Cause that's
for
billable.
Last year. I can email that out to you.
Do you know what I mean? That's what I'm getting at, is the ones that we made a run out with the truck, but we didn't bill anything.
Okay.
Okay, anything else?
I guess I'm a little confused about that. I thought we had changed from not billing to billing a minimum amount if we went.
Lifting people.
Yeah.
We do. We bill for,
Oh, okay.
yeah, we do.
Oh, okay.
But no, there's, like, when he was talking about going for support for other municipalities,
Yeah,
we get there with our truck, but we don't never, we
Right.
very seldom put anybody in the ambulance to transport them, to charge anything for that. We made a run out there.
right.
We didn't
Okay.
make any money.
All right. But not too long back, we were going to people's homes and not billing at all. Now if we go and we lift them up and get them,
We do.
But if we call and, they don't wanna go to the emergency room because they'll have to pay for a call. They call the ambulance, they come and check all their vitals, they
Right.
tell them they're okay, and they say, then I don't wanna transport. They didn't wanna pay for it in the first
Right,
place.
right.
We don't transport that person.
right, but we get a minimal fee now.
No, you don't
Yes,
bill
we
for
do.
that.
Yeah, there's
Yes,
two,
we
it's
do.
two,
Do you
it's
get for that one?
$200, isn't it?
Yes,
Yeah, I thought we had changed that and we started, how
What's a
much do
run
we charge
cost?
now?
it's a little over 200.
Okay.
What's a run cost?
Well, it's 200 for the lifting assist. If
Lift assist.
if it's an actual call, we do an assessment, it's the base charge.
Oh, is it the
Just
base
minus the
charge?
mileage, yeah.
Okay,
Okay, I thought we had changed that, yeah.
okay. Any other questions? Well, while we're on that, on the agenda next month, I want to put down raising the rates.
Yes, and raising the rates. In all the scenarios that we've done, those 5-8-year projections, we've done a 3% increase in rates per year in all those projections.
I'm talking maybe 100%.
What
Well-
difference does it make if you increase the rates? It's the reimbursement rate that's important.
Doesn't change dramatically, and that's the thing that shocked me. I thought it did. I was always under the impression that it did, and it doesn't. The insurance rate's based on a percentage, so if you charge $2,400 for that call, you might get 80% of it. If you charge $1,400, you get 80%. Yeah, I had the same reaction, Tom.
From the insurance company, then the subscribers on the
any
hook for
difference
the
with
So you want to raise the rate for every user?
Yes. No, yes, yes.
You'd have to raise it for
Right,
every
you do,
user.
you do. You're not gonna get any more for Medicaid and Medicare.
And do you have contracted rates with insurance companies?
We don't,
Percent of charge,
Oh,
percent of charge payment,
no. It's just a
flat rate, right,
Yep.
fixed fee, yeah,
Yep.
so you can raise it 20 to 2,000, you're still gonna get paid $800 or 1,000 or whatever it is. It's just the people that don't have insurance then will have to pay
A
a
larger
higher
amount.
rate.
No, insurance you're gonna get more too, aren't you?
Well, the insurance company's gonna pay what they pay. It's the subscriber that's gonna pay the difference.
Oh, the difference.
Yep.
So can you explain that again, Brandon? The insurance companies pay what they pay, but
Yeah, whatever's in their insurance contract, so if they pay 80%, you pay 20%, they're gonna pay their 80% of the bill. And then you as a
You get a
subscriber
copay,
would
you
cut
get
the
the
difference.
copay.
Yep.
That's why I'm saying that if we're struggling trying to raise salaries, and yet we haven't raised the rates on our calls, and the calls that Lakeview was charging was significantly more, we're leaving dollars on the table that we could be using for salaries. It's crazy that we're gonna raise our fees to the municipalities when we should be charging for what we're providing as a service.
Correct. And we did raise rates, remember, on January 1st, 2017.
A little bit. That's the
3%.
3% type
Yep.
thing we're doing, and I'm saying, no, we ought to come up a lot.
Well, what we've done every year is look at what other municipal services are charging, and then kind of figuring our rate structure as, competitive with River Falls, et cetera, right? So,
That's, yes, as you
yeah,
recall.
that's what we've been doing. We haven't been looking and saying, okay, we're comparing ourselves against a private service, but every year we've gone and looked, at least that I remember, we say, okay, what's this service charging? What's this service charging? Oh, we're low for ALS, but high for BLS or whatever, right? And,
Yeah, all the comparisons have been done within our county for
Right.
neighboring services.
right, and that's how we've done our fee structure.
Then I want to include the county distance that way. And the reason for that is that's where we're competing with the labor cost rate.
Right.
Well, yes and no, not by municipality. I mean, for instance, in a town like Troy where we're served by both municipalities, if all of a sudden you get $2,000 charge from Hudson and an $1,100 charge from River Falls, believe me, there'll be a lot of pressure to go all to River Falls.
Well, then go.
Well, that's,
Well, because River Falls has been supporting their cost based on college students, and they know that's shifting.
okay, well,
You
and
know
that's
what
what,
I mean?
that's what we need to understand
We
from.
need to have all of
this
that
task force,
discussion.
if that's, I mean, I have a letter in front of me right now that we just got from River Falls saying they want to get longer-term contracts with,
What do you
our
got?
town.
What do you got, a one-year contract?
yeah. And that's what we have, one-year ambulance contracts, they're saying that they'd like to have longer-term contracts. So-
Maybe we,
So, I
we
mean,
were the
every-
leader
every-
in longer term, maybe we need to be the leader in fees.
Everybody's jockeying in different ways here, and we just need to be careful, to say, okay, we're gonna double our fee, and then all of a sudden, somebody in Troy
But I'm
says,
sorry, if you'd have switched to Lakeview, that fee would have been doubled.
would have been,
Doubled.
yeah, but no,
$2,800 to $3,400 for a call.
but no town support. I mean, right now, the town of Troy is supporting each ambulance call, according to the analysis that was done by North Hudson, to over $1,000 a call. Right?
So it was just a little bit less than, well, about the same price a call would have been.
Yeah. I mean, that's the way I'm looking at it. I mean,
What would the difference been then?
well, we would have gotten rid of that $1,000 a call in
But the
town
custom,
support.
but your resident would have paid it.
Yeah, and then maybe we would have done what we did with fire right now. The fire situation is different, so what we do is charge all residents the same, no matter which municipality responds to a fire call. So I don't know, that's the problem when you're, serviced by two
Multiple
different
areas.
organizations. I mean, we had one organization that didn't want to charge for fire calls, another one that charged, X amount. So now, as a municipality, we manage,
Brenda,
yeah.
what is I know we have this somewhere, the percentage from insurance versus Medicaid, Medicare. Do
What
you have that,
percentage of our
Brandon?
calls is it? I want to say 72, but I've got it. in my book.
It's,
I didn't bring that
should
with
pull it
me.
up real quick.
She's done that.
I
Just,
should've pulled it
matter of
up,
fact, I just looked at that the other day. I agree with you, Tom. She's done that.
I'm going to find it. I don't have it right in front of me, but insurance, we receive 54%, Medicare 17, Medicaid 4, private pay 5.
It's a whole packet that
What
she
what
did.
I'm looking,
So-
what I'm
Yeah.
looking for is what percentage of runs are paid by insurance versus Medicare and Medicaid?
54%.
Do you have it?
No, that's the reimbursement rate. I'm looking at
Agreed.
how many runs are insurance versus Medicare and Medicaid.
That is the graph that I'm looking at too, Brandon.
Yeah,
Is that pie chart one?
Yep,
Okay. Well, there was more than one pie chart to that, though, wasn't there? There was like 8 pages
and
in
there's
that
a,
packet.
that's the graph with the average payment.
Oh. Oh, that's just the average payment. That isn't,
So the
that
average-
doesn't do what he wants either.
Yeah, the average payment by insurance right now is about $1,100.
Okay.
and what we've, here, I think I've got it. 28% of our runs are insurance.
Okay.
Was that your question?
That is, yeah,
Yep.
because before we start galloping down the road, let's figure out the financial impact if we can. You know, if we raise the rates, what will that mean in terms of revenue?
Does
And
that,
so 72% are government reimbursed then? So 28% are insurance, and then 72% are,
that's fuzzy.
There's some self-pay in there.
No,
There's some staff data that I agree with you.
There's people with no insurance. I'd be one of them.
But that doesn't reflect what's paid on co-pay then, does it either?
Yeah, it's
Where
in
does
there.
that show up?
Under, there's a,
Does that go into the insurance or does it go into other pay?
it would be under the bill patient or the self-pay portion, which is 11%.
Oh, so that's not
Income is coming from
necessarily
there.
uninsured then?
Yeah, copay and anything that's coming
Uninsured.
from the patient.
Okay. I wasn't sure where that showed up.
And what's the reimbursement rate for the uninsured and co-pays?
I don't have that in
We-
front of me right now.
the co-pays, we do have lumped in insurance. So if somebody is insurance, we're getting an average of $1,100 per call.
That is, their co-pay goes into insurance then?
Correct.
Okay.
Yep. Whereas if they're Medicare, we get $423 average per call.
And their co-pay for Medicare goes into Medicare?
It should, yep, it should.
And Medicaid, we don't get anything.
We get $229.
Other than the
Okay.
Medicaid payment, we can't get any co-pays, correct?
Correct.
It's flat fee and that's it.
And so, can I go back to the insurance? So 28% of our patients, 28% of our patients are insurance, but 54% of our revenue is insurance. And so there's the disconnect. Okay.
Oh, that's the number I think we were looking for, 28%.
Well, that's one of them, but, you know, we just need to figure out how much revenue is going to be generated by increasing the rates for insured
Yes.
users.
For all you, we'd increase rates for everybody, but really the insurance is where we'd get the money. And what we said last year during budget was we were increasing rates by 3%, but we really were only getting 1% more in revenue at the end of the day.
Yeah.
But we can go back now that we're into these new 2017 rates and analyze that some more.
Great.
Good. Any more on those sheets? You can continue then.
And then under accounts receivable reconciliation, you know, it's just important to watch that account balance, that's not creeping up, and it's not, it's at $342,000 at the end of June. Runs billed in June were 131 compared to 134 last year in June. So there's really nothing to note there. And then under the accounts receivable aging, the percent over 60 trended up a little bit, 8.6%, but it's still lower than it was last summer, and so that's a good thing. They're working through the receivable process quickly. Any other questions?
I don't, anybody else?
Oh, thanks.
Thank you very much. Ad hoc committee update and discussions.
Okay, so last night at the city council meeting, I was officially appointed as the liaison between the EMS commission and the public safety committee, so it's official. Anyway, everybody's got a handout here, but since it's not as part of the agenda notes, I will read through it and so that it gets into the record, and then explain things. And please, Brandon and Brenda and Jim, as I go through these, please let me speak up if you've got things to add on this. So we're in the brainstorming stage as far as what we can do to change things and make EMS self-sustaining or as close as possible to that. So methods to increase revenue, we've started a survey of other services looking for best practices. So have you put together the survey questions for the, okay, so that's something that we're going to have to get done soon. We've gotten some information from River Falls and from Monroe, Wisconsin. River Falls does have some payments in lieu of taxes, for example, from the university. They're also doing more community outreach and then Monroe, Wisconsin, they are self-sustaining. However, their budget is even leaner than ours is. People are on call. If they're on call, they aren't paid unless they're called in. But each of these,
How big a service is it, Joyce?
it's about the same size as ours.
Really?
Yes.
Comparable, yeah.
Wow. Where is Monroe?
Monroe, southwest of Madison, I believe.
Okay.
West of Madison, or southeast of Madison.
Greene County.
It's a ways.
Pardon? Yes. Okay, so, anyway, but each of these services, if we look carefully at what they've got, we can get some insights into things that we can try. For example, they built a $1.5 million facility with donations raised by a professional fundraiser. So we need to look more carefully at that. So others will be surveyed. All right, our billing service contract, when is our contract up, Brandon?
June.
June. So we need to send that out for RFP and see what else is available. We've looked at what River Falls is doing, and they're paying less for their service, so we need to do some comparisons. Something else that Brandon has explored is the state taking over collections, because if they take over the collections, instead of taking a percentage off, they add that percentage to the collections. So that would help with increasing revenue as well. Increased billing rates, which you're already talking about. So then lobbying the state to increase Medicaid payments, possibly through the League of Municipalities or another organization. Medicaid payments are just ridiculously low compared to the cost of the service.
And what are they in Minnesota?
Do you know what they are, Brandon?
Yeah, they're significantly higher.
That's one of the things we need to pressure our state about.
Yes, we do.
Why. Find out why.
And I've already sent emails to Shannon and Sheila asking about that.
I mean, they freeze our levy, but yet
Yes.
they don't allow other costs to come up. Okay, come on.
Yes, exactly.
Can't have it on both sides.
Yep, I agree with you there.
Well, we have that information, don't we?
We do, it's double.
Yeah, so we're at 151 for the base, and they're at 430.
But isn't that partly because they went with Obamacare?
Don't know, and that's what we need to find out. It very well might be.
I'm not sure on that.
I think it is.
But that should change in 2017, because that's when the federal money started going away. We don't hear about that in the discussion on the news media, and I don't know why not, because that's why Minnesota starts to go into the red dramatically now, because Wisconsin was one of the states that didn't take it.
Yeah, it was just in the paper the other day that some of that funding is
Started to trickle away.
Yeah, starting to go away, yeah. Yeah, they were talking about rates in Minnesota and how people are gonna be surprised that the governor threw all kind of extra money in there, but there's money that's leaving, so, yeah.
It's still gonna go up, yeah. Okay, go on.
All right, so then we need to look at the cost of service to Warren and whether to approach them for a per capita payment. Something else that we're looking at is there's a large number of nursing homes and other facilities. We need to analyze the calls from those facilities to see if they're using a disproportionate amount of services. You know, what we're trying to do is analyze, why does Hudson have 70% of the calls when we don't have that 70% of the population in this area? And so, do these nursing homes, you know, are they nonprofits? Do they pay taxes? If not, we need to consider payments in lieu of taxes in order to pay for the services that are provided to them. So other examples is the schools and I-94. How does that affect our number of runs? So we've got a lot of analysis to do. Brandon sees the need for more interfacility transfers, because those are the ones that usually are paid. We could consider hiring a professional fundraiser for facilities and capital equipment costs. There are outreach opportunities, community training, so first aid and CPR certification classes, other times that we could charge a fee for those services. All right, so then fewer ways of reducing costs, but again, the survey of other services looking for best practices. If we can reduce overtime, that will reduce our costs. All right, so a 501c3 is being set up. I don't believe that it's been completed, but Glenn Hartman has been leading that effort. There is a fundraiser on September 16th and so we won't have control of those funds, so what we need to do is look carefully at it and make sure that we have
Will it
strong
operate the
requests.
same way as Fire One?
Probably.
When you say "we," do you mean the city of Hudson or the EMS Commission?
All of us.
Well,
You know, I mean, it all,
But you're
We all
right,
work together.
we don't have any input with Fire One. They decide what they're gonna put that money toward. It's always toward the fire department.
right.
But they decide what they're gonna do with it.
But as a group, the EMS Commission can make requests. And I think, and it's important to do that, because if people know what it is that they're supporting and they've got a picture of that piece of equipment, that's going to help with the fundraising effort.
okay, is a 501c3, what's it called? Or who, is it for St. Croix EMS? Is it for the city of Hudson? Is it for some other group?
No, it will be for the St. Croix EMS.
Okay.
It's gonna have to have a different name, though.
I don't know what the, you know,
That's
And-
just
and
like
they-
Fire One does. It's
Yeah.
different than the Hudson Fire Department.
they're running it past Brenda before they submit all the paperwork.
Because St. Croix EMS is not a 501(c). You know what I mean?
Okay. Then also, what I mean by look again at partnering with neighboring services. In the study that was done in 2009, 2010, one of the things that they recommended was that neighboring services get together so that we don't all have ambulances available during times when we don't need that many ambulances. So if we can juggle things so that we're all working together and to have enough ambulances in the area, we might be able to save some money that way.
You mean mutual aid?
So,
No, it was like
Oh, it
what you
was in-
talked about with Roberts, wasn't it?
It was an agreement where they'd take turns staffing a transfer truck or an extra truck in, at that point, it was the Roberts area. It was gonna be a collaboration between 4 different agencies.
You mean you'd put a truck out somewhere outside the station?
Yes, it was the 2010 study, when they were trying to figure out how to kind of capitalize on some of the transfers and solve staffing issues that all 4 services at the time were having. That was
So
one
you-
of the suggestions.
And it worked all except for the rates, if I remember right. Everybody agreed with it, but the rates were so
Yeah, the
different.
municipalities couldn't
that they
get
couldn't
together
come to an
on the
agreement.
rates.
But you would take a St. Croix EMS ambulance and put it somewhere so that it could respond to calls from different areas?
That was the proposal, yeah, it would be.
That's dynamic
interfacility.
deployment.
It'd be for interfacility, it'd be you rotate it, so 1 week out of the month, each,
But it was dynamic
Service of doing it.
deployment for all 4 agencies.
I understand, but that's what it was. I mean, that's what it is,
Theoretically.
pre-positioning an ambulance to respond.
Trying to create a staffing model that would work.
So, we need to look at this again. Then, we need to survey our employees for additional ideas. We've got a source of ideas, and we need to utilize that. Do a SWOT analysis with the employees. For those who don't know what a SWOT analysis is, it's strengths, weaknesses, opportunities, and threats. And it is a good way of looking at your service and looking for ways of improving it. It's very commonly used in a lot of organizations. We need to ask the community for ideas. And then, what about the commission? Any additions? Did I miss things that are obvious or not so obvious?
Who are the members of the committee? Because I don't recall, maybe I missed the
That's a
meeting.
good question.
So we really don't have a formal committee. The Public Safety Committee has taken this on and appointed me to do this. And so Jim Weber is assisting with this, but we are meeting informally with Brandon, Josh, and now Brenda.
So it's you and Jim
Mm-hmm.
and who else?
Brandon,
So Brandon, Josh, and Brenda.
Okay.
basically you 4? Okay. Plus discussions within public safety, is that what I gather?
Yes. So we meet on Thursday with Public Safety, so I will be presenting this to Public Safety as well and asking for suggestions.
Okay. So how often you gonna meet?
We're probably going to be meeting about every 2 weeks in order to make sure that we
Okay.
keep this moving quickly.
In your plan of action to get things changed? Through public safety to here to council? To here to public safety to council?
It's,
What?
since I report to Public Safety, it's going to have to go from Public Safety to EMS to Council.
Okay. Okay. I just was trying to follow the process of what's gonna happen. Okay,
No, that's a good question. Oops.
okay. Anything else?
Of course, you're both hearing the same information. You could say, yeah, we want to take action on this, and we want to move this forward.
Oh, I see.
You could pull that way as well, so.
Okay, okay,
And some of it's going to depend on who meets first.
okay.
Because this week, you meet first, and then Public Safety meets on Thursday.
Okay.
With it being budget time, do we want to look at the Warren situation? Maybe get that on the next agenda?
I think we ought to send somebody down there. The 2 times I went there, I got stonewalled, and Sue went with me.
Would you, and we've discussed this before, but would St. Croix EMS consider not providing services to them unless they pay?
You know, we'd lose revenue either way, if they didn't pay or if they, I guess it's kind of a decision that we'd have to make as a group.
The last time we decided that we would not provide, we would provide service, we warned them that if we had other calls, I think Kim actually notified them and said, if we have other calls, we will not be coming down to pick up your residents.
They've got contracts with New Richmond, with Baldwin, right?
Yep.
And they,
And there's another one,
River Falls.
River
Yep.
Falls. How many calls do we get? 30 a year?
Roughly, yeah. We're just a few less than what we do in Troy. And that's why it kind of popped up on the radar is they're getting almost as much service as Troy is.
and New Richmond hit them for a big fund when they built their new building. And that's when Sue and I went down there, was when they had just coughed up all the money to New Richmond to pay for their new facility. And they went, well, we can't do both.
So the
So you-
revenue from them is how
We-
much?
We serve about 402 people in that area, so.
So the
What do
per
we end up with our per
capita
capita at?
versus how much you're getting in
We
revenue?
make, we make more in run revenue than we do in the per capita.
It would be more?
It would be more, yeah.
And it should be. The way the per capita formula works, it should be.
So how many runs total out of Warren? Because you're giving them away.
30 to 40 we do roughly in that area.
What's the total estimate of that?
In Warren in general, I don't know. It's serviced by 4 different departments,
Yeah.
so.
How was that map originally? At the county level, that map that sits down on the wall, how was that determined on where those areas to service was determined, who will provide it?
It's when the municipalities negotiated their contracts with who would serve. Similar to how Troy adjusts boundaries occasionally.
How did we end up with a portion of Warren?
Had it for as long as I've known. Do you know going back at all, Ben?
Closest,
Yeah.
probably to their western area.
We did lose some of that area when they annexed the Flying J.
Oh, okay.
So the entire village of Roberts is covered by New Richmond.
Okay.
So people understand when you talk about changing boundaries in Troy, it's only usually by a street or two, right?
Right, but I mean, it's,
Right,
they have the ability to make the changes.
right, okay, but, yeah.
And so even some of that, you even talked about River Falls sometimes changed the boundary.
Oh, yeah, we've had many
Without
meetings
Hudson
where we've
knowing.
had contention between where exactly the boundary is or isn't, or who has this street and which side of the street.
So it'll be an uphill battle, and I would suggest somebody from city council go see how uphill it is.
Are you recommending me?
Yeah, I would.
So if,
Because I went
Yeah.
twice, because I went by myself and Sue came with me the second time. And we really pushed them hard. Said we might not be able to provide the service, and then, well, that's the way it's gonna be. They didn't care. There's their town board.
So their next meeting is August 21st. Do we need to do anything here, make a motion or anything, or should we just work on trying to get out there?
Yeah.
Well, if you're not prepared to call their bluff, and when they say no again, why do it? It's an
I
empty,
agree.
it's an
I
empty,
tend to
it's
agree
an
with
empty
you.
threat. I mean, unless you're prepared to say, we're not gonna go serve you, and not do it, they know that from prior times that you'll still do it. So unless we're prepared to say we're not gonna service them, it's a waste of time, in my opinion.
I
or
agree.
maybe it's the kind of thing where the ad hoc committee can come up with 2 service rates. If you get picked up and you're not in the service area that's paying, it's $2,000 a run, you know?
Oh,
They
We-
already do get charged a non-resident rate.
What's that?
They already do get charged a non-resident rate.
Which is,
It's a little higher than ours.
but it's only a little.
Yeah.
yeah.
So I think it's
that's like,
$200
you know, maybe that's the thing where you go, okay, it's $2,000. I mean, it doesn't seem fair that a Troy resident pay $1,000 and we're subsidizing another 1,000. I mean, that doesn't.
Yeah, we'd gain about 5,800 in per capita payments versus potentially losing 40 grand in run revenue.
So that's what my point was before.
Yep.
You make more in billing than you would get per capita.
True.
So just let it go. I mean, unless you're willing to give up the
I
billings.
agree with Ray, though. If we're gonna do it, maybe what we ought to be doing is raising the non-resident rate.
Yeah, we can do that, sure.
Yeah, you know what I mean? And we don't even need to talk to Warren about that, we just do it.
Yeah, just do it, yeah.
Upgrade on that. Not creating that.
Right, the friction, yeah.
Can do an out-of-service area rate. I've done that in the past. I don't know if because a non-resident rate, Joanne, correct me if I'm wrong, does that mean that if we pick somebody out of the area, or is it somebody that's not a citizen or resident of one of the?
They're not a resident of this.
So if we pick up
of
people
our
on the
service
interstate in an accident,
Right.
and they're from Illinois, they get the non-resident rate?
Non-resident.
area.
Yep.
Okay.
So you can have.
A non,
rate higher.
out-of-service area rate?
Out-of-service area? Mhm.
I like that option.
So is that the choice?
I like that.
Okay.
That way you're not nailing everybody on the interstate, but maybe we want to consider that. I don't know.
I've got a note on that.
We should look at both of it and
Yes.
see what the effects of it is on the service, because that does affect us all.
Oh, yes. So what I'd like to ask each of you to do is look this over. Tell me what you think should be high priority items for us. Send me an email or send Brandon an email and let us know where you think we should be concentrating our efforts first. Any other questions or additions or suggestions?
Just going back to the increased billing rates, I think that needs to be something that we look at annually versus every few years like we have in the past.
Yes.
Brandon, I remember you saying that still water increases their rates 8% every year.
We were told that that was what it was. It was 8%. I don't know if that's exact now. Do you know what it is?
It'd be 3.5,
Okay.
based on market, and then it depends if we fall below market.
What do you guys do, Ben? 8. So,
Again, similar, we're a nonprofit, but we recognize that we get about 46 cents on the dollar. So if we raise it 8, we're getting less than 4 back.
yeah.
If we don't do that every year, we get behind.
And here's the reason we're at where we're at. In 2003, the town of Hudson looked at changing service and going to Lakeview. And the important part of this discussion is, at that time, the write-offs for the city of Hudson, St. Croix EMS was 20% and Lakeview's were 30%. That's where all of the profits for EMS services have gone. It's in the change in the write-off that's killing us all. And that's why we kept struggling with raising rates, because they just keep saying, no, we're not gonna pay. And why and how did they come to that calculation? I don't know. You know, how did they decide that we're only gonna pay 46% of the bill? And why did they decide that that's normal? When
Well,
all EMS service nationwide is struggling. It isn't just here.
well, yeah, but part of the reason that, at least I understood, Health Partners had a better shot at being financially solvent with this is are you classified as a critical care? Is that what it is? A critical care hospital or at Hudson Hospital here?
Critical Access Hospital.
What is it?
Critical Access.
Critical access. As a critical access hospital, you get higher government reimbursements than we do as a municipal service,
Or
right?
insurance reimbursements.
Yeah,
From
government.
From government, from Medicare.
Oh, from government too.
Yes. Yeah, so as a critical, that was one of the things that was in the thing, is a critical access hospital, they get more reimbursement than we can as a municipal service. So,
Maybe we should be talking to our federal representative.
well, you're not gonna, yeah, we're gonna impact federal law, right? No,
Well, I'm sorry, Ray, that's not just for our little service in Hudson, though. That's affecting everybody nationwide when they made decisions like that.
I understand that, but you and I will be dead before those decisions are made, Tim.
Really?
Okay, anything else?
No? Thank you, Joyce. Discussion of possible action on implementation of staffing model number 3.
All right, so at the ad hoc committee level, we were discussing staffing, and there's been pretty consistent holes still with our staffing. So the recommendation was we approach moving forward to option 3 in September with the staffing change and the rate increases. We did do a budget impact analysis. Brenda, do you have those numbers for what it would?
Clarification, did you just say a rate increase?
The pay rate increase for the,
pay rate
yep,
increase, yeah.
for that model.
So for EMTs, it's important to remember right now that we have 3 on-call or being paid per shift at all times because they respond from home. And so we need to have 3. And Brandon explained that, why we have 3 now and we're going to 2.
Yep, so it covered primary and backup. The change would be we'd put the paramedic and the EMT on the ambulance together. So it'd be the full crew, 2 full crews staffed that way at the ALS level. So we'd end up changing that.
How's that gonna financially affect things?
It's actually the same financial impact because now we're only going to have 2 that are sitting at the station to respond.
Will it make it easier to get staff members?
It will. It's going to be a little closer to market for their wages to get them in the door. That's kind of what we're struggling with right now. We're just not competitive. We just had that open paramedic position. We ended up with 2 applicants. I just got the second application yesterday. Kind of got lost in the shuffle, but we only had 2 applicants for that.
Is that one acceptable?
I looked it over last night, so I think we'll probably be calling and setting something up to talk to the person, but we're kind of struggling with not being competitive there.
Closer is something that concerns me. Because if it doesn't get us to where we need to get to be able to hire people, we're still at you and Josh doing all of that a year later, making all those calls. And I'm sorry, we said a year ago that wasn't a good idea.
It's a significant jump,
Okay,
so it should be attractive.
okay.
And back to the EMTs, so I said it was a 0 financial impact change, but that is if without as long as
No overtime?
no overtime, and that they're staying on 24 hours per week and lower. So Brandon is comfortable that he can make that work.
Scheduling wise?
Yeah.
So I guess,
Staffing wise?
I guess I am a little confused here. The system that we have now and the fact that it's so responsive, I thought was predicated on the fact that the paramedic was in the chase vehicle and that if they went to someplace and the call didn't require a paramedic, that the paramedic returned here. If we now have the paramedic and the EMT in the ambulance, does that take our paramedics out of service more frequently?
It wouldn't because they're going to be staffed the same. So the intent was getting that first paramedic available for backup calls because we didn't always have a backup medic.
Yeah.
With this system, you're going to have a medic on each ambulance. So you'd alleviate that issue of not having a second
Short
medic.
term or long term?
That'd be the long term.
Long term.
Yep. You're going to have 2
Mean-
staffed ALS trucks.
Okay, you mean 4 or 5 years from now?
Yeah.
Oh, okay.
You know,
Okay, so that's where I'm confused. So are we talking about going next year to the paramedic EMT or 4 years from now?
no, this would be immediate, but we would be adding the positions as we go to make them a full-time benefited position. We'd still staff,
So what are you
As
gonna,
such
how are you
right
gonna
now?
staff now?
so it'd be the full-time medic on one ambulance
In
with an
that shift,
EMT.
one full-time paramedic
Yes,
and an EMT?
yes. And then the second one would still be the stipend. As we add positions, the stipend one would go away, and they'd be an hourly
In the new model?
in the new model.
When
Yep.
the new model gonna take place?
That's what we're shooting for, is the September 1st.
Okay,
And Brandon, you have 2 trucks 24/7.
Right, and that would give us the 2 truck coverage 24/7.
With one more paramedic?
Right, you'd have 2 on at all times.
So, Brandon, I'm looking at the information from Brenda back in May about option 3. And it says currently St. Croix EMS is staffed with 2 paramedics and 3 EMTs on each 12-hour shift.
Right.
How is that gonna change?
So we'll lose one EMT position, and they'll both, it'll be a paramedic EMT ambulance, so 2 ambulances, ALS, that can go, you know, if it's a BLS call, then the paramedic can drive, you know, it's more versatile that way.
But the EMTs are gonna be here now?
Yes, they'll be on site with the hourly wage, that changes it, and that's gonna decrease the response times because they're with their partner ready to go.
So the difference is before, as I understood it, the paramedic, the reason that we said we could have fast response time is because the paramedic had the chase vehicle, right?
Yep, and they could
And the
immediately go.
and the paramedic could jump in that chase vehicle immediately and go to the site.
Yep,
And then the EMTs, who could be at home, right?
absolutely.
Had to come into the service, and they had to be here within, what, 4 to?
4 minutes.
Okay, so they had 4 minutes to get here, get in the ambulance, and then go to the site.
Right.
And at the site, we had 2 EMTs and a paramedic, right?
Yep,
And then it was assessed, what kind of call is this, right? And if the call didn't require a paramedic, the paramedic could return here, and the 2 EMTs could take the person to the hospital or whatever,
right.
right? Okay. So now we're gonna bring the EMTs here, right?
Yep.
All right.
Yep, so this will bring all the staff in-house together, the crews will be together, ready to go. So that will decrease the response
So-
times.
I want to make sure I get the paramedic side of this. So the first truck will have a paramedic and an EMT that are sitting here in the station, and they're ready to go, and when they get the call, the 2 of them go out in the ambulance.
Yep,
Not the chase vehicle.
right.
The second ambulance has 2 EMTs on it. Is
No.
that running with,
Second one will be an EMT and a paramedic as well.
still as a paramedic now? So
So
we
there
got
has to be-
staff to do that 24/7?
That's what we're
How
working
many
towards,
staff
and that's
do
why we need
to
to,
hire to do that?
we'll need a few more medics.
How many's a few more?
It depends on their availability.
Okay.
That's what we're leaning towards. Once we get that, all those full-time positions, that's the total that we needed.
You don't have the full-time paramedics, can we make the switch?
With a handful of part-timers, yeah.
Okay.
It'll be similar to the way it is now with the backup.
Brandon,
Because that's gonna be
was
that same rate for now.
the idea of having the chase vehicle, was that somebody get to the scene quicker?
Yes, that was the initial.
So how is this gonna affect the response time?
It'll be essentially the same as getting that chase vehicle out the door, except you'll have the full ambulance crew.
Do we
One
need,
less person.
Yeah.
do we need to have 2 ALS ambulances staffed 24/7? What about, do we have numbers as to how many runs there are from 10 PM to 6 AM?
We're working on getting those numbers, but the short answer is yes, we do. And that's for that whole interfacility piece. If we don't have a second ALS ambulance, we can't do ALS transfers. And
The
their
transfer's done.
transfers are kind of all over the board,
Okay.
you know, different times of day and night,
And when
so.
they want
Do we
it.
have an idea of when most of the transfers are done? I'm assuming it's during business hours, but maybe my assumption.
Not necessarily. A lot of them happen overnight. The more emergent type stuff will happen at night when there's lack of capabilities at the local hospital.
Do we have numbers on when we do those runs?
I'm actually working on getting that chart right now
Okay,
with their software, so I'll be able to give you a list of calls done by hour of the day.
okay.
Thank you.
Well, I'm a little uncomfortable saying we're moving towards option 3, because option 3 is a 5-year plan. And I really would like to hear back from the ad hoc committee before we say we're moving forward with a 5-year plan. I'm not uncomfortable figuring out, okay, what is our short-term plan here to make sure the service is
I think
sustainable?
the short-term plan, Ray, is to continue to operate the way we are, is using Josh and him with overtime.
Well, so that's what I was pushing.
Maybe I'm wrong,
Well,
but you
that's,
can tell me.
that's what I was pushing for last meeting, is to say, okay, let's hire the additional paramedic. Let's keep things the way they are now, because we say that, I mean, we've been in here saying the services.
Then they need to answer the question, did you hire the paramedic?
No, we haven't yet.
Why not?
I just got the second application yesterday, but
And so we didn't have hardly any applications of applying for it, and why is it, in my gut feel is, tell me if I'm wrong, I think it's the salary.
yeah, we're not competitive in that aspect.
So that's why you have, so you want to do that, Ray, but it isn't moving forward.
Right, so maybe.
That's where we were a year ago, wasn't
So
moving forward.
maybe where we are is not competitive in our paramedic pay, and that needs to be adjusted. It doesn't mean we need to be changing our whole system here short. I mean, maybe.
Trying to come up with a model that says, how do you pay for that, correct?
Right.
And that's the way you move forward with it, was how do you pay for it? And you quit paying for the third person during that shift. Am I wrong?
No.
That's the way
no,
I
but-
interpreted it.
No, but what I hear Brenda saying is we're gonna pay the EMTs more to be on site. So the cost of the two EMTs on site is going to be about the same as the 3 EMTs on call.
Correct.
Now, you're gonna
So-
have a paramedic and an EMT and a paramedic and an EMT, not 3 EMTs on the site. Correct? You're gonna have para twos.
Yes.
Paramedic and an EMT and a paramedic of an EMT. And you're getting rid of, in that shift, 1 EMT on every shift.
Yeah, but it's not changing the finances. That's what Ray's
Not
point
changing the
is.
finances,
The numbers are the same.
because we're gonna pay them more to be on site.
And that was my valid point, was how do you pay for that? If you want to raise the rate, how do you pay for that? You pay for that by getting rid of the third EMT.
No, it's not, that's not what's happening. It's neutral. It's neutral in a cost way, because you're paying more for the EMTs. To have two
What
of
do you
them.
mean it's neutral?
It's not gonna affect, that's what we talked about before. It's neutral, right?
Correct, the expense is neutral, so.
But you're raising the rate. You can't raise the rate and keep the model the same. You can't
Right.
raise the rate of the new paramedic without finding a way to pay for that. If you do that, and that's what Ray's asking you to do, is don't change the model, just raise the rate of the paramedic, and then our budget goes up. That's the way I interpret what you
There's
said.
two separate things.
Yep.
One, the model that Brandon's proposing is cost neutral. The second issue is, do we have to raise the rate for paramedics in order to staff it?
But the way he's doing that and proposing it, Ray is saying is a 5-year model.
No,
I'm just, I don't,
I'm saying I don't want to commit to a 5-year model until I understand what the cost implications are there. I mean, when we looked at that 5-year model, Troy's cost, if I remember right in the analysis that was done, went from $27,000 to like $72,000 over a 4 to 5 year period. I mean, if we're talking about, okay, discuss possible action on implementation of staffing model, I'm just saying, okay, these staffing models are long-range plans. I'm just saying, let's not make a commitment to a long-range plan. Let's just figure out short-term. I mean, if short-term, what we need to do is have 2 EMTs on site, which is gonna cost any more than 3 on call,
But
then let's say, okay, that's our short-term plan on managing the service.
I got really confused as we talked about those different models, personally. Because I heard people saying that we're gonna go to the $72 an hour, $72 per capita right now. And I'm going, no, we're gonna phase that in, is the
No, it
way
wasn't-
I always
No,
interpreted
it wasn't
that.
$72 per capita.
There was discussions to do that, like taking your 27 to 72 was right now.
I don't think so, Tim. I don't think.
There
it
was, I heard discussions of that, and here's my point. I don't think we were ever gonna do that.
I guess I never heard that, Tim, but.
So what's your problem?
No, we went from 27,000 to 72,000 for a total bill to the town. That's not per capita.
But, okay, but you're saying that we're gonna phase that in. You're saying you don't wanna get into the phase-in program, is what you're saying. I'm trying to understand what you
right.
want, Ray.
What I'm saying is, we said we're trying to come up with a, let me see it here. A self-sustaining or close as possible financial situation, right? What that model is, I don't know. I mean,
They don't know either,
It
Rick.
certainly is not, it is certainly not what's proposed, because what's proposed takes Troy from 27,000 to 72,000.
No,
Yes.
no, no. What
That
he's
was what-
propo-
well,
he- But
that-
what he's proposing right now is only changing it from 27 to 27. Because your cost didn't change. If things move up the ladder, then it might, Ray. But you're gonna be here to make that change.
And that I'm fine with. Here it says, discuss possible action on implementation of Staffing Model 3. Staffing Model 3 is this long-range plan, right?
But it was a phase-in plan, Ray.
Planning just a staffing model.
It's increase in rates, it's
It's moving to
moving to, right. And all I'm saying is,
things that are involved in that.
and all I'm saying is,
Go back and look at what the staffing model is going to cost.
right,
Pull that piece out and look at that. I think
Right.
Yep.
That's the.
The way I interpret this, I agree with Jim. All this is doing is, we pulled out the staffing model, and there was no cost change to that. Am I wrong?
oh, yes, no, that's not true. We end up with 8, with the Staffing Model
Today.
3, we end up with 8
Not 3,
paramedics.
today.
Right.
Today.
Right, okay. So maybe what we need to do is define, what are we talking about? Are we talking about our support of a short-term plan to go from 3 EMTs to 2 EMTs as a short-term way of running the service as we decide what is our long-term plan? See, the only thing that
hear
I'm
what Ray
concerned
is
about
saying.
is that this is, Staffing Model 3 is a long-term plan to have 8 to 9
We need to
paramedics.
get the eraser out and wash Model 3 off the chalkboard.
Okay.
We do. Because what Ray is talking about is, I don't want to agree to that Model 3 if I don't know what
He's
we're...
looking at the 5-year.
Yeah, and
That's
that's
what-
not what you're looking
We're
at.
looking at the first year of option.
Right.
Yeah.
Is what we're.
Right, well,
And
model-
that's short-term plan.
Right, Model 3 is a 5-year plan.
Right, okay. So
Right.
we need
But
to
you don't
change
want to
our-
talk about Model 3 being a 5-year plan either. You want to change
It's-
that.
But we have to implement the first year.
Portions of
option
things.
3 in order to be able to
Yep,
implement
that's what we're
some
looking
of
at.
these changes.
I s-
Yep.
I suggest that you do away with calling it option 3.
I
Come up
agree.
with a 1-year plan.
Let's
talk about-
Yes, I
That's all I
agree.
was concerned about. It says.
I agree.
Let's, it says, implement Model 3, and Model 3 is
But we're not
an 8 or
addressing.
9.
So maybe we should be talking about implementing year 1 of Model 3.
No,
or
don't
just-
even get away
I
from
agree.
Model 3.
Short-term
Calling it
plan
something new.
for changes.
Calling it
Short-term
something new.
plan for changes.
So do we just want to table this or readdress it at the next meeting with a 1-year plan? Is that what we're looking for?
Yeah, I
You
think
do
that's
have
the
a
way to
one-year
go.
plan right there,
But
right?
Brandon,
Yep.
the crux is that the paramedic part of this is what's causing the issues for us.
Yeah, it's holding us up, trying to get
Okay,
people in the
so
door.
are the people that you're interviewing telling you that the rates aren't what they should be? Or are you finding that independently, comparing
They
our
didn't
rates
apply.
to?
Tell them why.
Both, and then lack of applicants. We're just,
Because you advertised what you.
we advertised several places. We ran the posting longer than we normally do. We ran it for a month.
Do you have any idea why we're not getting applicants?
Primarily, it's the pay structure.
And how
You
could
can
that
drive
be
20
changed?
minutes and get $5 to $6 an hour more.
Okay. So we're going to have to increase our rates for paramedics in order to get somebody?
Yeah. Yep.
So by the next meeting, can we have an idea of what that needs to be in order to attract candidates?
Didn't you?
Definitely, we can refine it. We'll do a more current one. We did one a year ago when we're doing the budget stuff then, but we can do that again.
And I think we were looking at, we compared rates with River Falls, New Richmond, I don't forget where else, but we're competing against the metro area.
Right, absolutely, yeah.
Okay, I think we need to get that part figured out before we do anything else.
And that's why when I talked about rate structure. I said we need to go beyond the river, because we're competing with salaries, we ought to be, if we're competing with salaries, we ought to be also talking about the rate that they're charging to pay the salaries that they're paying. You know what I mean?
We need to look at the big picture.
We don't look at what Baldwin's paying for rate, you know?
Yes.
So,
And I think the council is in line with that, because we're looking at that in other areas as well. That
Yes.
There's not River Falls we're competing with in Richmond, it's also
Across the river, because we're so close to the river, and the metropolitan area of which we're part of.
so if we hire another paramedic, how many paramedics will we have, full-time?
We'll have 4, because
Four.
that's replacing the
Big short
vacancy.
one.
Yep.
Okay?
For almost a year.
So we'll have 4 full-time paramedics. And is that going to staff this model that you're talking about, or it'll be staffed with other part-time paramedics?
It would still be with part-time, and it's
Okay.
going to be with part-time until we get to that.
And would we
5
have to
years.
increase the salary of part-time paramedics as well?
Yeah, it would have to be in line.
Okay, so how many full-time paramedics does it take to staff the model you're proposing for next year? 6?
For next year, the overall is still 9, but we've been able to supplement it with part-time due to the decrease in benefits, and that was kind of our trade-off. We'd have more part-time until we got to that point. So we'd have to increase our part-time by
So-
at least 5 or 6.
So the model you're projecting for next year, short-term, is the equivalent of 9 full-time paramedics?
No, not quite.
Well,
It would
okay, okay, what, I'm confused
So,
again.
I
Okay.
guess, yeah, I'm kind of trying to figure out how to explain it.
Well, how many full-time equivalent paramedics do you need to run the 2 paramedics here full-time along with the 2 EMTs here full-time? How many equivalent full-time paramedics do you need to do that?
Maybe 9 total.
9 total. So
Right.
for next year, what you're telling us as a commission is that your proposal is really for 9 full-time equivalent paramedics.
Right. The trade-off was we were going to staff the majority of them we were going to staff 5 next year, so we'd add 1 next year. And then each year going on, we'd add 1, but in the interim, we would do it with part-time staff to keep the cost of the benefits down
But I'm
and spread the
confused.
increase.
I agree with Ray. What does the cost variation come from? Is it lack of benefits with the
Lack of
part-time?
benefits. Yeah, that's why we were adding the full-time positions.
Why do you need to add a full-time rather than part-time paramedics?
The benefits is what attracts them and keeps them.
But if we can get sufficient numbers with part-time, why would we go to full-time?
If,
starting to look at
right,
retention
yeah,
with full-time people,
definitely want to look towards retention.
paying them part-time.
One of
You
the
know.
issues that we have is that this becomes a training ground. So we're training them and then they're going elsewhere. So we need to look at how we can make sure that we retain our employees.
Got to have incentive to keep them in the door.
So now that I understand, we need basically 9 full-time, and we'll take the benefits out of there.
Yep.
If each of those 9 equivalents works 2,000 hours a year, and we give them a raise of $3 to $4, right? So you give them $4 raise to become equivalent, that's $8,000 a year per person, times 9. We're looking at somewhere between $70,000 and $80,000 in budget increase just to support that change.
Right.
Seem right?
Seems about right.
All right.
Rough
Okay,
numbers,
now I understand what you're telling us,
If I
okay.
understand the ad hoc committee, they're saying if we need $70,000 to $80,000 in increase in budget, how can we fund that? Correct? So that we can be more sustainable as a close to service cost, whether that's rate increases or whatever the options that are out there.
But this will allow us to do more interfacility transfers, so that's
Right.
going to help with increasing that. It's also going to help us with doing some more outreach, and that's going to help with increasing some revenue as well. So,
Outreach, explain that to me.
so.
Yeah.
why should-
So it gives us the opportunity to do in-house training. We can have companies come in, do their in-house training if we have staff around to do it. Right now, we don't have staff around to do that. We've had several companies approach us within the last couple months wanting us to do those type of services.
WITC.
Right, and they're just,
Who's paying for that, us or the employee?
for the classes that,
Training.
I'm talking about outside agencies coming to us for, looking for training.
Oh, for us
So we've
for
had,
training.
yeah, we've had businesses requesting, on-site first aid training, CPR training.
Oh.
If we have staff that are available to do that, that's revenue in for us.
Oh, I get it.
Yep.
Okay.
And then on the transfer piece, it would be guaranteed staffing of the 2 trucks. Right now, we don't have the guaranteed staffing of the second truck.
Is that a model that works, that training in businesses elsewhere?
There's quite a few places that do that and do well.
Okay.
Maybe we can wrap this up. Brenda, do you have something to add on this?
As, when we started in January, looking at a staffing model, just remember that our first proposal that we'd heard from the EMS department was we need 9 full-time paramedics and 9 full-time EMTs, and that was a per capita of $39.25. And so we said, we can't afford that, our partners can't afford that, and that's where we came up with the staffing model of staging the full-time paramedics, of hiring 1 per year for the next 5 years till we got to 9. So just recall that we had looked at that.
So, yeah, there is, so that's where I got confused, Ray. It is a 9.
It is 9 at
It
year
is
5.
9 paramedics, they're just not all 9 full-time right away.
Right,
They're
we staged
part-time.
it just to
It's
accommodate.
a benefit package that's
budgets and-
Okay, thank you. Anything else? How about moving to 6, discussion possible action, purchase capital equipment of radios, monitors, et cetera.
All right, so on our capital replacement list this year, we had 3 Zoll monitors. We've been able to dial that back down to purchasing 2. They're able to do the overnight service, which kind of eliminates the need for us having the spare on site. The quote in there includes a pretty generous trade-in of $7,000. If we're to pass on this, that trade-in won't be available anymore. The model that we're trading in has been end-of-lifed, so they kind of squeezed this in before they were told they could no longer take it on trade. So the bottom line for 2 monitors is $59,858.70. And then the other quote you have is for upgrading the 3 current monitors that we have to enable carbon monoxide monitoring. That's something that we discussed when we purchased them, that we do the upgrade at a later date. So we have the quote there for that. The cables are a different set of cables, and that's why there's the increase in the upgrade. The upgrade itself is only $28,000 per unit, but then we have to add another roughly $900 in cables to make it compatible. The cables are an item that we replace regularly, so we don't depreciate those. So those can come out of a different line item if needed.
Why are they replaced regularly?
So they're really thin metal wires inside, and when they get rolled up and put in the cases, they degrade over
Snap.
time. Yep.
Okay.
So we're just looking for a recommendation to do
So
the 3
give me the
upgrades.
bottom line there. Is it the 64
No, it's 59,
plus the 11?
yep,
This is in the budget, right?
it is budgeted, yeah. We budgeted for 3 and we're purchasing 2.
Yeah.
So,
I'll move that we proceed with purchasing the Zoll monitors, and the price is $59,858.70 per monitor.
nope, that's for 2 monitors.
Okay,
But you want the plus 11, right?
And then the upgrades are the 11, 122.
all right.
For a total of 62, basically?
Yeah, what is the total amount?
72? Yes, 72.
22.
I'll second the motion.
And then the upgrading the radio equipment, I'm still working with our vendor on that. We're having some issues getting the appropriate quotes. for the equipment that we need. So I'll bring that back to the next meeting.
Okay. So
She hasn't been able to quote me the right item.
the total I got for that is 72,080.96. I don't know if
That's my
anybody-
motion then.
Okay.
And Ray, you second that?
Yes.
Wait a second. Any further discussion? The only part of the discussion I would want to do is make sure that, because you'd mentioned it earlier, the radios will be part of that cost that'll be coming out of budgeting for the 3 monitors, just so that we know next month when that comes
Yeah,
back.
so the cost savings from that third monitor was where we.
Will
picked
help
that
pay
up.
for the radios that are needed to upgrade.
And so far, what I'm looking at right now is roughly 18,000.
Okay, thank you. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, like sign, motion carries. Thank you. Number 7, discuss possible action on bylaws. I'm really confused with this personally.
Which part are you confused about?
Why we would discuss, and I don't know where it came from, of the municipalities having somebody sit in for them, and whether they'd need to vote or not. And I don't know where that came from.
You mean having an alternate?
Yeah.
I thought you brought it up.
Yeah, I think so.
I was told that somebody wanted to do that, so I went back to my board and they said, no, they just show up and they don't need to vote. And the bylaws don't allow for that to occur today. So I'll give you the example. When I was gone and Jeff Johnson came, technically Jeff shouldn't have been able to vote. Does everybody agree with that?
You should have been able to.
Should not have been able to vote. Because the bylaws say it's a representative that's recommended by the chair, president, which the mayor, whichever municipality is, and that's not the person that's sitting here, according to our bylaws. I just want to make sure I understand that we all agree to that. Because I don't know where it came up originally.
Well, it has to be changed, so that's why we're talking about it, right? If you want to have it that way.
I don't know. If we want to leave it the way it is, that means that they can't vote is all.
Well, yeah, my question would be legally, if they can't vote, do they make the quorum or not?
No.
Okay, so if 2 of us are gone, no meeting.
No, you still get a meeting.
Yeah,
You got 3.
3.
Okay.
So if 2 of you are gone and there's an alternate sitting here that isn't a designated alternate, then you can't meet. So if there's 3 gone, really, and you're bringing an alternate in.
If there's 2 gone,
No, 3.
no, wait a second, if
The
there's,
alternate is the 3rd one.
yeah, if there's 2 gone, we can't vote on anything financial,
That's right.
you know, so.
No, you can.
No, we
You
can't.
just can't vote. There's nothing in the bylaws that says you can meet, and once you've determined in the classification for meeting, you just can't. The bylaws don't say you can't do what you're asking to do.
Section 7, this person from the hospital, this person shall be a voting member except in financial or
Correct.
contractual matters. So how are you gonna, if you have 2 people here, that's not a quorum.
The meeting was a quorum because they're a member as a member for the quorum to meet.
I know,
And
but
once you determine that you can meet, it just takes a majority vote.
well, getting back to the point that we were discussing, do we want to amend it so that a designated alternate for each municipal member
Can
can
be a voting.
can
member.
attend and be a voting member?
I'm okay with that. That's why I'm confused. I didn't bring it up intentionally to do
I
that.
think we should change it, and if the person who's here in that capacity doesn't feel qualified at that point to weigh in, they can always abstain. You know what I mean?
Let me ask another question, because today, the way it reads in there, it says that the town chair, the mayor, the president determines who that person will be,
Right.
and it's recommended. Can we say in there that the municipality may at any time send an alternate? And the reason I say that is Tom's not available to come, and neither is Joyce, but Jim wants to come, but the mayor identified Joyce as the alternate. Jim's still got the same problem that our bylaws say today, other than if you say that the mayor may designate any other alternate council representative to be the alternate. And I'm just asking so that I understand what you're gonna put, what you're gonna have Catherine put in the verbiage.
Why don't a suggestion, I'll write a section 11 that addresses that, and we
Okay.
can talk about it the next meeting.
Sounds good.
It'll be section 11 of Article 7.
Thank you.
While we're doing that change, can we look over the entire bylaws? There's some sections that are kind of outdated, and maybe just do a full 360 and update the whole thing?
Do you wanna sit down?
Or is
with
that something
Fran?
that you want to move on right away with your section?
I don't think so. Cause those are usually done by April.
Yeah, so is the EMS Commission ceding authority over bylaws to the ad hoc committee?
No,
No, okay.
I don't believe so.
You just said that they were looking at it or something?
Oh, no, I wanted to look as a,
No, you
as
should
a
look
group
at it.
here to look over it. I think there's some changes that we need to make.
There are
that
other things that need to
there's a
be
lot of-
changed.
A lot of outdated stuff on there.
Well, why don't we just postpone this and look at the whole thing and
Okay.
just go over it?
All right.
You wanna bring some recommendations back next
Yeah,
month?
I've already made some notes for some things, so.
I'll sit down with you. Okay. All right. Thank you. Anything further on that? Number 8, medical director's update. Anything? None. Chief's report.
The only update I have is we still have that vacancy. I did get a second application that came in during the allowed time period, but it didn't make it to me till yesterday. So we're gonna go through those two that we received and see if we can make a hiring decision on that.
Okay. That's it for that?
That's it.
Okay. Future agenda items. Minutes, financial report, IDAC committee discussion update,
The additional capital items.
additional capital items.
Well, what about the financial impact of the staffing changes and going to
Short-term
try to come up with the
staffing.
information about runs? You want to leave the town of Warren thing and just let it go?
Well, maybe a good action item would be is to ask Brenda to come up with, what'd you call it, out-of-service rate?
I agree. I like that.
Out-of-service area rate or something?
Non-resident versus out-of-service rate.
You have the bylaws on there, Tim?
Yes. Okay, bylaws, and then, chief's, directors, medical directors update, chief's report, and a date.
One thing, since we're on TV, you mentioned a fundraiser on September 16th. What is it? Where is it? I mean, people, I haven't seen any signs for it or anything like that, so, is it a golf thing? Is it,
It's gonna be an all-day event at Big Guys Barbecue
Okay,
on September 16th from, I don't recall the time.
11 a.m. to 7 p.m.
Yeah, it's a full-day deal. They're gonna be doing beanbag tournaments and having
Okay.
some silent auction type stuff. And of course, the buffet.
that's on a Saturday or?
That's for St. Croix EMS.
Yes.
It is
Yep.
a Saturday.
It's not the dive team or,
Right.
okay.
And there are flyers out. It's also on our Facebook page.
Oh, didn't you notice that on your,
On TV, so
you didn't notice that on your Facebook page?
I don't follow that often, and
I wasn't slamming you, I don't either.
It was on Facebook.
well, it doesn't come into my news feed then, apparently. I don't go and search each individual
11 to
site.
7,
Yeah.
that was the time, out at Big Guys.
Yep.
Okay.
Send out the flyer with the minutes.
Yeah.
Thank you, thank you. That was a good point. I missed that. It went right over my head. I heard it, but it just didn't register. Okay, anything else? Date. September, we gonna wait that long? Or do we need to meet for any other, I can't think of any reason why we need to meet before that. Well, yeah, I can, but, because I'm gone from the 2nd to the 13th of September,
What days do you usually meet?
Tuesdays.
Tuesdays? Because I'm working, starting at the end of the month, I will be working in Balsam Lake at 9 o'clock on Tuesday and Thursday mornings. So I have to leave here by 8. So I can give my report early in the meeting and then leave, but it would be nice if I could stay for the whole meeting. Start at 6:30? Yeah, right.
I didn't suggest that, that was Jim.
I mean, I wouldn't have any trouble starting at 7. Anybody else?
I don't either. I'm okay with that.
Can we meet on a Monday or a Wednesday?
Yeah, if we've started earlier, we can meet on Mondays and Wednesdays. Wednesdays anytime. Other than, how about Thursday, the 14th? That doesn't work for you either.
No.
No, because Tuesdays and Thursdays I have to be in Balsam Lake from 9 until 11:30.
Well, I'm pushing it out if I tell you I want to go all the way to the 18th. Do you want to meet without me? You can. Would you meet like the 5th or the 12th?
I have to look, I forgot my phone. Maybe what we can do is just put out 3 or 4 alternative dates and we can figure it out from there. Wednesdays. Or one other day a month.
Because even Wednesday, the 20th, I have a fire advisory board meeting at 8 o'clock on the 20th. I'm not back on the 6th or the 13th if you want to do it. But that's okay, you can meet without me.
Fire was 13.
I thought we moved it to the 20th. I'll have to go back and look at the emails.
Yeah, I
She
think
said
there was
she-
something that came out to say it was moved.
Well, there conflicts was gonna be.
Me.
And
I was still out of
I
town.
thought it went to the 13th, but, no, I mean,
Jeff would come in your stead if we had it without you?
I believe so.
Well, let's just get some alternative dates, like 3 or 4, and you can shoot an email out to us and we can tell which ones would work.
Okay. I'll entertain a motion to adjourn.
So moved.
second.
Motion's been made and seconded. All in favor, say aye.
Aye.
Aye. Opposed, like sign. Motion carries. Thank you.